Welcome to the Dr. April Jasper Show, relevant conversations for business owners of today. Hi, everyone. Welcome to the Dr. April Jasper Show. This is a special show sponsored by Visionary Optics, and we'll tell you who they are in just a few minutes. But really, the important part of this show is Dr. Ashley Tucker. So I think she's amazing. She and I were on a panel together. I think it was here at SECO, wasn't it?
I think it was.
A couple years ago. Yeah. And we talked about myopia, which is still a big conversation topic today. And I think you spent a few hours talking about myopia just earlier today, right?
Absolutely did. It's something that I cannot avoid talking about, honestly. It wasn't the topic for the Contact Lens Summit, but it trickled in there, of course.
Love it. Well, and I think that brings us to why you're here today. You're just incredible because of the fact, in my opinion, you're incredible because you care about your patients, and that's what you really focus on first. And
Thank you, April.
Yeah, I think you're amazing. So not everybody knows you the way I know you. So I like to start out with my listeners and our viewers because some people are watching us. You can see we're at this lovely location, but I want them to know who you are. Okay. So tell them about Ashley, Dr. Ashley Tucker.
Okay. So I'll tell you about Dr. Ashley Tucker. Then I'll talk to you about Ashley Tucker.
Woo!
Okay. So Dr. Ashley Tucker, let's go way back, graduated from the University of Florida. So go Gators. I don't know if you knew that fun fact.
Wow.
Then went on to U of H optometry school and did a 1-year cornea and contact lens residency also there. So during that time, specialty contact lenses became my thing. I didn't realize that's the path that I was on, but to take it a little bit further back, my dad has keratoconus. So that's what motivated me to be an eye doctor and then subsequently a specialty contact lens fitter because of him. So anyway, at U of H, optometry school, residency, all that, developed a passion for specialty contact lenses of all kinds. Scleral lenses, of course, and then orthokeratology was a huge part of what I learned. And then I went into private practice, and it was just a natural transition to bring that with me. I mean, you can't learn all that and just let that go.
Right.
So I joined the practice that I'm now a partner in. Originally, it was a specialty practice just for kids. It was a pediatric binocular vision therapy practice. And my boss, then partner now, said, why don't you come in and try specialty contact lenses here? Like, really? In a pediatric practice? How? But it was easier than I thought. Yeah. You just start with one patient and the rest is history. Now, Ashley Tucker, on the other hand, I'm a proud mom of 2 kids. I have a 13-year-old daughter, Aubrey, and an 11-year-old son, Camden, that bring me so much joy, more joy than I ever could imagine. So that motivates me to do these spectacular things I get a chance to do, to show them that a mom can be more than the traditional sense of a mom. She can do a lot. She can manage a lot. So
yeah, you do.
I try.
So Dad, how is Dad? And was he excited about the fact that you became his doctor?
Dad is the most loving, endearing. I'm going to tear up about my dad. Oh gosh. Yes.
I would be the same. Yeah. My dad is too.
My dad and I have a very special relationship. Yes. Unfortunately, funny story, Dad sees 20/10 in specialty contact lenses.
Oh my gosh.
But won't wear them. Isn't that unbelievable? Because he has never lived in that type of clarity. Yep. He spent his entire life in the 20/40, 20/30 range, and he appreciates that he sees so well, but he cannot tolerate the HD is what he calls it. And he also identifies with glasses. And I said, Dad, I can put you in glasses over your contacts. He calls me Pookie. He's like, Pookie, I just can't. That's just too much clarity. I see too much. I'm like, okay, Dad.
I'm used to the world the way it's been,
Ashley. Exactly. So Dad is a work in progress, 15 plus years
what
in the making.
What do you call Dad? Just Dad?
I call Dad and Pookie. It's like this weird little reciprocated
I had a
thing.
feeling.
Yeah,
I love that.
We do together. So, yeah.
But you know what? I think it's a very valid point. When you don't reach people early on, it's a difficult change for them, isn't it?
Exactly. It's one of those mysteries of specialty care that it's like the psychology of it, right? That no one really prepares you for.
Yep.
Like I thought he'd be doing cartwheels.
Yeah.
And he was. He felt like he was disappointing me, but I understood. I'm like, Dad, whatever makes you happy. It's all good. They're there when you want them.
So tell me, as your passion became your life, like your passion for taking care of these patients that nobody else is taking care of, it became just the way of life for you. And at some point you became involved with Visionary Optics.
Right.
and their products and their technology. Tell me more about that.
So this goes all the way back to residency. So when I was a resident, I looked for manufacturers. I looked for companies that really supported residents and had a great consultation team. So I started fitting Visionary Optics back when they were Jupiter and then Europa to residency. And then after residency, I was reaching out to companies that would just help me get started, help me get fitting sets. And they were super generous. So I fit Europa exclusively for the first several years in practice.
Wow.
Yeah.
And do you feel like, so what makes Visionary Optics stand out? I mean, we're going to get into some details,
Sure.
but tell me some things that really stand out to you about them. I mean, you already fit scleral lenses, like you said. But then, and when you started, did you have technology?
I had no technology. I didn't even have a topographer because remember, this was a pediatric practice. So I had an autorefractor and I had my skill set and a Europa fitting set. That's it. And so what made them stand out was the consultation team, because I needed a lot of support. Even though it's been a year fitting sclerals, you still don't know everything. So having a team that I could talk to and ask the dumb questions to, that made all the difference. And my ability and my skill level improved because of the support that I had with their consultation team.
So what does that look like? You can make a phone call, you can email.
You can, all the things. So
Okay.
initially I felt like I needed a personal connection. I needed to talk to someone.
Right.
And then I realized that was taking a little bit too much of my time to wait on hold. Not that it was a long time, but it was more efficient for me to email the details, email pictures, email OCTs, and then they would get back to me within a reasonable amount of time. So it transitioned from calling to talking to someone one-on-one to feeling confident enough to communicate via email.
And then the newest part of this whole process for you is technology, right? Tell us what you have and what you're thinking about
I have all the things now. let's say I eventually did get a topographer, so that was really helpful. I would highly recommend making sure you have a topographer when you're managing specialty contact lens patients, but I had to do what I had to do initially. And now I'm really excited to have a profilometer, the eye contour. That was a wish that I had for so many years. Yeah. And to be able to partner with Visionary Optics and get one was just such a pivotal moment in my career. So I can't wait to delve into that a little bit more.
Yeah. I think there are people that don't even know what that is. So why don't we start from the beginning? What is and why eye contour?
Yes. So since I had such a great relationship with Visionary Optics, there was trust there. There was trust that what they were telling me about the equipment and the technology was what it actually was. Because, there's some doubt that people put a bow on things that don't necessarily deserve the notoriety. So a profilometer is essentially a very special piece of equipment that I tell my patients gives me a profile of their ocular surface. It gives me a map of their ocular surface. And because of that, I can make a lens that matches all the different nuances of their cornea. So I know we'll talk about this more, but this has truly changed the way that I practice.
So let's back up for just a second, because Visionary Optics, so they make the lenses. I think there's people that don't know the connection in the company. So start with, you said you knew eye contour was going to be awesome because you already worked with Visionary Optics. So Visionary Optics is who makes your contacts.
Correct.
Eye contour helps you take the measurements to then be able to send automatically. Can you send it from the technology?
You can send it. There is a profilometer, the piece of equipment. So you can think of it as like a fancy topographer in a way. And then that information speaks to the laptop that sits right next to it. And then I can make the order through the laptop, through the technology. I know.
So how fast is that? Talk to me.
Okay. Fast, April. So fast. So do you want to talk about how we gather the images?
Let's do that.
Let's do that.
Yeah.
Okay. So can I take you through like a patient experience?
Let's do it.
Okay.
Talk to me even as a patient if you want to.
Sure.
So yeah.
Sure.
Let's hear it the way it goes.
Sure. So I'll talk about the patient experience first.
Okay.
So for me, it's very important that my patients don't go directly into technology. So I have my technician put them into an exam room and I connect with them for about 5 to 10 minutes. I want to know all the things. I want to know their history. I want to know if they've tried contact lenses, failed in contact lenses. Are you already in a scleral lens that you're unhappy with? All those things need to be delineated by me. I don't like to get it secondhand. So I usually spend about 5 to 15 minutes with my patients. If they can be eye contoured, like I say that day, meaning they have not worn a scleral lens because you don't get a good map if they have a scleral lens on. So we'll say the patient comes in with a naked eye. Perfect. That's the perfect scenario. So then I message my technician and she'll come in and talk to my patient about the process. So what she'll say is that we're getting ready to go into this room. You're going to get a drop, an anesthetic drop in your eye, has a little bit of dye in it as well. And we'll take 3 images, one of your eye looking straight ahead, one looking up, and one looking down. The 2 of us will decide if she needs my help. She'll give me a little cue light. Because some people, you can just tell they're going to be able to open their eyes just fine. Other people are a little leery of the explanation, or they have really small fissures. So we kind of bounce off of each other.
Would I be a good patient?
You'd be a wonderful patient. So most of the time, though, she can handle it on her own.
Okay.
So after that, she takes the patient for a little while, and I will pop in and see another patient during that time. I don't necessarily need to be there during the imaging process. So then she will send me a message of what trial lens I need to pull from the fitting set to put on the eye. So
how does she know that?
Based on the maps that she gets, she's stitching together basically a profile of the eye, and then the technology automatically tells her what trial lens is closest to the shape of the eye. So we have this streamlined. So she'll send me a message. If I'm not busy, I'll get that lens cleaned, ready to go, and then she'll send me a message for the other eye. Most of the time, though, after she takes the images, she's going to clean the lenses and put the lenses on for me.
That's great.
I know. So I have time now to go see another patient. So this is a beautiful process. By the time she has both of them on, she will then get an auto refraction over the lenses. Okay. That takes out me fishing for sill, retting. Who wants to ret? So that auto refraction gives me a really good starting point for my over refraction. Okay. So what I love is that over refraction point where I get to really show the vision. Like that's the cherry on top, right?
Celebrate.
So it's a celebration. It's usually tearful, joyful. It's rarely ever anything less than that, to be honest with you. So then we talk about the nuances, like how long it's going to take to get the lenses, what we can expect at the follow-up visit, and then they're on their way.
So how long did that take?
That probably took me 30 minutes total, but broken up into 2 parts.
I love it. So now, if the patient's never worn a lens, are they putting the lens in themselves, or
my technician is doing everything? And you have to remember that they're numb, so it's actually very easy to put that lens in. So I will also tell patients, I'll be honest with them, because they'll say, I can't feel a thing. I'm like, yes, that's true. You still won't feel a thing, but you are numb right now. I just want it to be transparent, like it's going to feel very similar to that, but we just have a laughing moment because we've told them that they're anesthetized, but they just forget.
Now, do you teach them how to put the lenses in and out that day?
That's a really great question. I tend to do it another day. Even though they're only with me for 30 minutes, they're probably in the office for about an hour. So they're kind of burnt out on that. So that's part of the close. Yeah. I'll tell them next time this visit will be all about you. We're going to focus on teaching you how to put them in, take them out. We'll give you all of the starting supplies that you need. You're going to feel great when you leave here. Every now and then I'll have a patient that is super anxious, so I'll send them home with a little QR code of a tutorial that we have for insertion and removal.
Who has? You have?
We've created in our office.
Nice.
Yeah, it's really cool. Now that I'm saying that out loud, we probably should send that home with everyone, but we have a pretty streamlined process for INR the next time.
And how long? So since we're on it, let's keep going. Okay. So they come back, visit 2, which is, and did this patient already have a comprehensive exam somewhere else even?
Usually these are referrals, but I will do the comprehensive exam if I need to as well. So that's tacked on to the first part.
Okay. So now how long until they come back to get their lenses?
Sure. So I'll tell them 10 days to 2 weeks. I like to err on the side of being safe. Yes. Yep. Otherwise, patients are going to be calling it, 10 days or a week, and their lenses are being manufactured. So I try to set them up for not being disappointed.
And they're super excited because you just showed them what they're going to see.
Exactly. They can't wait. And most of the time they see better just with the trial lens. So they want that. And I'm like, no. I need that.
Exactly. All right, so let's back up. Okay. Now, when did it's been a little bit of time since you've had this amazing technology. Yes. When you brought it in, what was that like, bringing it into your practice?
Okay, so I've had it since May of last year, so my brain's kind of tired. I don't know how many months
It's
that's
okay,
been.
I know.
Just shy of a year. It was wonderful. So we had a wonderful consultant, her name is Belinda, come in and do a full day's training. I think it ended up being 2 days. We had set up several patients for her to help us, and she literally walked us through every single step. And she didn't leave until we felt confident. So that part was seamless. I just want to give her props because she really was good at just holding our hand and helping us get through a kind of a challenging transition, because my technician, as wonderful as she is, she's not too adept to change. So she was very nervous about tacking on something else that Dr. Tucker needs her to do, but it went really well.
What else? Who was part of that training? So that's the other thing I always want to know.
Yeah. So me, my main technician, and then 2 other technicians for backup, because my main technician won't be available. She might have a vacation or call in sick or something. So we had 2 additional technicians trained as well. And then my associate doctor, who also fits Sclerals, was there.
That's great.
Yeah.
Now let's talk about, so you had your training, you brought patients in, and I think that any doctor that's listening, or even patients, what's really cool about that is you have an opportunity right there to really do a lot with the technology and also have it be a good return on investment for you right from the very beginning, right?
That's true. That's true. The biggest return for me is a return on my time.
Yes.
Time is priceless, to be honest with you. And when you set the stage that, your vision's going to be great, this lens is going to be great, nothing is better than being able to do that immediately on that very first dispense. Because back when I was fitting without a profilometer, which was fine, I had to learn, I had to learn how to troubleshoot and fit on my own, but the profilometer has just increased my first lens success dramatically. So I feel confident telling patients that, the first lens may not be great, but it's going to be pretty darn good. And I always deliver on that.
Well, that's another question I had for you is, what is this like now? How has it changed your workflow? So you told us what it's like today, but before you had eye contour, what was it like?
So if we go way back, there are some fits that would go beyond the 90-day warranty, and I just would have to, no one should ever eat the warranty, but there were times where I did over promise and under deliver, and nothing is worse than that as a practitioner. Yeah. So I feel like the profilometer has really negated all of that. I can feel confident in what I'm telling the patient, but even as short as a year ago, on average, I would say three remakes. That's just where I was. And I don't know if that's high or low, but that's just where I was. That's reality for us. So
that means 4 visits.
4 visits, yes. And, there were probably some that were a dozen, and there were some that were 1, but on average, it was about 3 remakes until I got the lens to a point where I felt really confident that's the best I could do.
And that isn't a lot. It's not just you that suffers when you have to do that. It's the patient as well.
Yes.
I can't imagine psychologically what's going on in their head.
Yeah, you start to wonder if they have lost confidence in you, or if they are losing confidence in you.
Right. Yeah, I hear you.
That's a hard pill to swallow.
At what point did your team, your staff, say, I like this?
Oh gosh, this is a good one, April. Okay, so every time I had a patient come back for a follow-up, I made them run OCTs 360. So the fact that they don't have to do that on any patient anymore, I shouldn't say any patient, but on most patients, because I tell them only do those if the patient is uncomfortable or unhappy with the fit. So the fact that they don't have to run a dozen OCTs, inter-segment OCTs, every visit 10 times a day, because that's how many patients we see with sclerals, they are ecstatic. So I thought they'd be a little bit resistant to doing the scans for profilometry, but they'd much rather do that than run OCTs for helping me troubleshoot the fit.
That's a good point. So tell me this, are there patients now that you would say you have had success with that you wouldn't have had before, or just a really special success story? Tell me a patient story.
Yes, there are several patients that I probably would have done an impression-based lens instead of an impression-based lens, because that's all I had other than just fitting traditionally. So I rarely lean on impression-based lenses anymore, but the biggest impact for me are patients with peripheral obstructions like blebs or pterygia, those sorts of things, or to me a nightmare to deal with regular diagnostic fitting, just because of the notching and the irregularity. So that's the type of patient that I am so happy to fit.
So that brings me back to what this technology even does.
Okay.
So let's go back to the beginning. You said it takes a great image of the front surface of the eye. Are we talking like how big of an image? Is it a lot different than topography?
It is a whole lot different. I'm not exactly sure how much further out, but it takes a very extensive image that they then take those images and figure out the ideal diameter.
That's right. And you told me you look up,
you look down, you look straight ahead. And the more data we can get, the better. So I've trained my technician, try to get as wide of a gaze as you possibly can to give them the most data. And they will create a lens that has the ideal diameter for the patient.
Nice. Now, do you still have to use OCT?
To troubleshoot or just...
at all?
Rarely. I really try to limit it just to the patients that are having trouble with their fit.
Any challenges? Because I really want to be fair and honest and, give us a good story of what's real. Tell me the best part and tell me the things that maybe are a watch out for somebody who buys eye contour. What is the best way for them to integrate it into their practice and help them to have the best success with it right from the beginning?
That is a really great question. I think the best way is if you're looking for something, I've mentioned this before, that will save you time.
Yeah.
That will allow you to wow your patients initially. Who doesn't want that, right? But of course, equipment comes with a cost and we have to warrant that. But once you get to the point where you are feeling like you're drowning in remakes,
yes,
I would say this would be your answer. Now, gosh, thinking about the worst part, I honestly, I
think it would be just you have to use it. So I kind of,
for sure. Yeah.
I think what's sad to me is I've seen people bring in technology and
that
they don't use it.
Okay.
It sits in the corner and it's going to be as good as you make it.
That's
right?
true.
So I think what you did, and it sounds very perfect in my mind, is bring it in, bring the team in. And the team is amazing. What was her name again?
Her name is Sarah.
Not everybody can have Sarah.
That is true. And the other thing is, we as doctors feel that we can do everything. We could just be every part of the practice. You have to delegate the images to someone else. Like that is a key part to success. Otherwise, you will not get that return on your time.
Did you start by not delegating as much, or did you do it right from the beginning?
I did it right from the beginning. I have learned that about myself, that I want to take it all on, but I can be really good at delegating when I need to. And that's something that I've learned about myself in the last 15 years of practicing.
So tell me about the second visit. Now the patient comes in, they're going to pick up their lenses. Walk me through what happens on that day.
Sure. So my technician will pull them from the lobby. At this point, I don't necessarily need to connect with the patient initially, but if I see them in the hall, I'll say, oh my gosh, today's the day. Are you ready? So they'll sit down with my technician for an indefinite amount of time. Okay. So we're very strategic in scheduling what we call dispense visits. We never schedule more than 2 a morning. We never have one at 4 o'clock because right before lunch. Like, you're setting yourself up for frustration.
Right.
So my patient will sit with the technician until they feel confident putting the lenses in. Then they will come directly to me. We're not going to have them take them off. We'll have them come to the exam room, check vision, and then I will assess the fit, make sure I put my blessing on it. Most of the time it's wonderful. I'll do an over refraction at that visit. I typically do not change the power because I want to let the lens settle, see what's happening. If for some reason it's way off, of course I'm going to change it. But if it's plus or minus a half, plus or minus 75, I'm leaving that alone, especially if the patient's happy. And then after all that happens, I answer any questions, and then we send the patient out to do removal training.
Are you telling me that you sometimes have first lens success?
Oh, I often have first
lens my gosh.
Very, very, very often.
Wow.
Yeah, most of them are dispensable and not just barely dispensable. Like, I am very happy with the result, and so is the patient.
Wow.
Yeah.
So let me ask you this, and I don't know the answer, so I'll just ask. Sure. Have you ever worn these lenses?
Oh, I'm wearing them right now.
Look at you.
Yeah.
Okay. What was that like? And I'm sure you wear Visionary Optics lenses, and did you have the
profilometry? I did.
Okay.
So just a little bit about myself. So I have high astigmatism. I probably have form fruits keratoconus. So Likely, but I have very irregular astigmatism.
Does Daddy know?
Daddy does know. He knows this is all his fault, but I don't make him feel bad about it or anything.
It's not his fault.
Yeah, it really isn't. It's just genetics. It is what it is. But anyway, so I have tried to wear soft lenses, but because of the oblique astigmatism, I just can't. I have more cil than sphere. So I'm a disaster when it comes to contact lenses. Yes. So I wore hybrids for years, just getting by. And I'm an advocate for hybrids. I love them. It just wasn't for me because I had a lot of residual cil. So I'm like the perfect candidate for a scleral. I just never trusted anybody in my practice to fit them on me. So when the profilometer came and Sarah became really good at taking scans, I had her scan me immediately. My first pair of latitudes, which is a fancy scleral lens that Visionary Optics makes, I'm wearing right now, my very first pair.
So you guys can't see her as closely as I can. Maybe they can. Maybe they can zoom in. I don't know. But I can't even tell. That's incredible.
I love that it gives me a wide-eyed look, too. It lifts my lids a little bit, you know. I don't have to use that Monique.
I love it. So they're comfortable?
Very comfortable. Extremely. It's probably the most comfortable, consistent vision I've ever had.
Wow. All right. So what are the watch outs? And I want to get to that at some point because there are patients that listen to this too.
Okay.
And so some of the things I want to hit on, and they might be the same things doctors want to hear that don't have any experience with scleral lenses. But what are some of the things as a patient that if you were the patient going to your practice, you would choose you because of what you do? Like, what are the things patients need to be looking for when they go to look for someone to go to for scleral lenses?
That's a great question. So, there's a lot.
You're allowed to brag. It's okay.
Okay. There's a lot of what I call dabblers in scleral lens care. So if I were a patient, I would call the office and ask, how many scleral lenses does Dr. So-and-so fit per month, per week? Or if the team has no idea what a scleral lens is when you call, you probably want to call another office. Another really great distinction is fellows of the Scleral Lens Education Society. That is almost guaranteed that you're going to get someone that has a lot of experience. So if I were a patient, that's where I'd start. I'd go to the Find a Practitioner part of the Scleral Lens Education Society and look for a fellow in your area.
That's good.
Yeah.
And what do you say about your favorite patient? I asked you earlier. Now I gave you some time to think about it. And let me rephrase it because they're all our favorite patients.
They are.
So tell me about a patient that soon after you got the eye contour, they came in and you had a specific case that really was like, I love this thing.
Got it.
I got to have it. Everybody should know about this.
So I can think of a very specific patient. So she's an 85-year-old lady who has very, very small fissures. And that's not the problem. It's just that we could never get her in a lens that she would consider comfortable. I fit her in everything I knew to fit her in. I tried everything I could. And the minute I got the profilometer, she was on my top list. I didn't have her come when Belinda was there because I knew she's a little fussy, a little,
the patient.
She's 85.
Not Belinda.
Not Belinda. Oh, no. This patient. I knew she needed a little bit more time than what Belinda probably had to offer that day. But once we fit her in the eye contours, she experienced a comfort that she'd never been able to. And I knew there was something just that I couldn't align with her lens and the eye contour took care of that. So that patient is a testament that anybody can find success. If an 85-year-old patient that could not successfully wear contacts can learn to put a scleral lens that was custom to the shape of her eye. We customized the diameter too to make it as small as we possibly could to fit her well. Like those are the things that make this technology outstanding. I told the lab, like, I need this as small as you can make it. And they did. It was like a 15.8 diameter, I think, which was perfect for her.
So you take the measurements on the eye contour and then you send them, you said it goes to the laptop, then you can send them straight to Visionary Optics.
Correct.
They design the lens. Any conversation you can have via email.
You can have via the platform. So there's all these different sections on the ordering system where you can put special notes like, I need you to ship them to the patient this time, or I need you to add a hydropeg, or anything you want to tell them, you can put in the ordering platform.
Who do you use the eye contour on?
Everybody. I don't
talk to me about that.
I don't differentiate anymore. That's a great question because I thought I might do it on some and not do it on others. But we've gotten so spoiled with the success that everybody deserves that. And I've just packaged my scleral lenses to a point where I just feel comfortable that they're getting a lot of value for the price point of the scleral lens. And patients, they appreciate time being saved on their end too, because most patients have had an experience that wasn't so great in other offices.
Sure.
So they immediately understand and respect the value.
Does it do anything else? Eye contour, the technology?
No, it just takes a heck of a profile. So that's all I need.
That's all you need?
That's all I need.
I've always said, if I could ask, and I would tell Visionary Optics, Medmont, I would tell them the same thing. If I had the choice, and I'll ask you, if you had the choice of a piece of technology doing 10 things sort of okay, or one thing really well, what would you say?
For sure, one thing really well. 100%. And I do want to mention the fact that it doesn't take up, it's not a big footprint. It's about the size of a normal topographer. So I was really worried about that, because although we're in a really big practice, we are just cram for space. So it just fit in my pretest room pretty seamlessly. So that's something I want to advocate for, that the footprint is not significantly more than just a regular piece of equipment.
So I guess sort of closing thoughts, but here's the thing. I think people listening, if it's a doctor listening to our show, how do they know if this is a good fit for them? Eye contour sounds like, honestly, I think it would be great for anybody and everybody to have. I think you take your dabblers and all of a sudden they'd become
expert fitters.
That's
true.
Is that even a possible thing, you think?
I think it can boost your confidence a lot. Okay. And I have some kind of funny feelings about that, because, I took a journey through scleral lens fitting. I think it's important to get the basics and understand what you're doing.
You want us all to learn from the ground up?
I do want us all to learn the hard way, and that's selfish, but it's not the right way to think about this. We're about the greater good. We are about helping people, giving them the best. So I would say, for anybody that just wants to offer their patients the best in an efficient manner, this piece of equipment is for you.
Closing thoughts. So tell us, the last year has got to have been fun. Have you increased the number of patients you've been able to see that are scleral lens patients because of it?
I'm sure I have. I'm so grateful. I have a regular influx of patients. Yeah. It's just the follow-up care, not filling 10-minute spots, every other visit with somebody that's unhappy with their scleral lens. Like, just my quality of life, my quality of practicing, the difference it's making in my team, not having to triage so many scleral lens issues. Wow. That's priceless. So
and then I guess I don't want to leave our patients out. So if a patient were listening and had a chance to ask you a question right now, Dr. Tucker, one of the questions I think would be, at what point should they go seek out a doctor to see if scleral lenses are right for them?
If you are currently unhappy with your vision, currently unhappy with the way contact lenses feel, if you've been told you cannot wear contact lenses, because I would argue it's very rare that a patient truly can't. I mean, of course there are, but at least seek out a consultation from a fitter, just to get a firm yes or firm no, because I would argue all of those people could be successfully fit in a scleral. Or if you're already in a scleral and you're unhappy with the way that scleral fits, give somebody with a profilometer a chance to fit you.
That's good. And even for fellow doctors, if you don't have a profilometer, and I know that you do, I would send a patient to Dr. Tucker.
I appreciate that.
Because I want them to have the best.
Yes, and I would take care of them and send them right back to you. We could co-manage this. That's the way it should be done. Again, it's about the greater good. It's not about stealing patients, taking patients. It's about doing what's best for the patient.
Absolutely. Yeah. Dr. Tucker, thank you so much.
Are we really done?
I think so. No way. I think that this has been amazing.
Oh, okay.
I feel like what's going to happen as a result of this, and that's our goal for this podcast, is we want to inspire people. We want to educate, but in the end, we want them to go, I can do this. I love this idea. And I think that a lot of people just didn't know before this moment that Visionary Optics and Eye Contour, which is made by Medmont, I mean, they've got all this technology. They've got the lenses. They can make our life easier, and that makes us better doctors.
That's right.
Thank you for being here with us.
Thank you for having me.